Okay, so we're going to be doing what's called ultrasound guided trigger finger release. Trigger finger is when there is a tendon that gets caught on a pulley called the A1 pulley, and it causes the finger to stick. We treat these conservatively with steroid injections, and if that doesn't work, then there are procedures to make it go away. Traditionally, people do what's called an open release, where you make an incision in the hand and open the sheath and then put stitches in to close it. This is a closed technique which can be done in the office easily and doesn't require any stitches. So you can see what a trigger finger release, or what a trigger finger is, excuse me. If you could open your hand wide and then make a fist as tight as you can. Squeeze tight. Now open your hand, and this finger, that one's actually that's actually a locking one. That's a more severe one. And in this case, you can see he's actually lost some of his ability to extend the finger from having this for a while. Hopefully that will get better, but the main indication is to get rid of that click. And the nice thing about doing this procedure in the office with him wide awake is I will check it before we leave today, and we'll know that it was released, because he won't be able to do that after we're done. So I do a prep like I would in the operating room. And we put sterile drapes and everything. I just use a simple alcohol-based prep. I've not had issues with infection, having done over 1,000 of these. So my pretty sterile green gloves. When you're not filming, I usually put on a little soothing music to relax the patient. We have a repeat customer here, so he's not nervous because he knows how great this procedure is. This is the instrument that I use, and there's a little blade that you can barely see. That's the blade that actually cuts the pulley. This is an instrument that goes underneath the pulley, and then once I get in the right position, I just push this instrument, and that little blade cuts the pulley. So this is called a transducer. This is part of the ultrasound machine. I use this to help guide where to put my instrument to do the release. I do some writing on the skin to show my landmarks and where to aim the instrument. First I make a tiny little incision. I numbed him before you guys came. So that's my standard incision, which is a total of 4 millimeters in length. As opposed to making an incision about this big, if I was going to do it open. And then I put in a scissors right above what's called the A1 pulley. That's the pulley that the tendon's getting caught on, and I just spread it a little bit to make room for the blade. And then I have him straighten his fingers as far as he can, and then I try to put this instrument under the A1 pulley, but on top of the tendon. And the way to tell is I have to look at this ultrasound image, and I look for where the blade is. I can see it's too superficial, so I go in a little bit deeper. Still too superficial. So that looks good. The white thing, Lizzie, can you point at the white dot on the screen? That's the edge of the blade, and right underneath it, the black thing is the tendon. Lizzie's done some maybe with me. I think she's ready to do them herself if I'm not here. Okay, so I look like I'm right under the tendon, so Once I check that, I turn the blade sideways so I don't cut the skin. I advance it. And I check one more time. I'm in the right spot. And then I look at parallel to the tendon. It looks perfect. Save that. And then I just gently move that blade forward. That cuts the pulley. Again, he's numb, so that's it. Once you don't feel resistance, you're done. So then I look again, and I should be able to put the instrument in right on the tendon. Save that. And then when I go like this, it comes way out. Save that. Show Lizzie, point at the white again. So it's way out, now it's in. So that looks like it's completely released. My final, and actually there's one place where it sometimes will get stuck and not show, and that's just at the top. So I just kind of feel, I've done this so many times, I know what it feels like. I just make sure the sheath is released. And the final test is I have the patient squeeze, make a tight fist, open. Okay, so there's still something locking, so we did not get a complete release. So when that happens, we just go right back in. Try to figure out where it's getting caught. Right on top of the tendon, so that looks good. Definitely under the tendon, save that. Sometimes I'll just run it again. Feels released. Sure, it's getting caught. Try again, make a fist. Open. Open. Okay. I'm not sure what I did, but rather it fail now, and I can fix it than have you come in next time. Make a fist again. Open. Do it again. Open. We're done. So that's all there is to this. I usually tell patients when I put the music on that this whole procedure takes 3 songs. It's about how long it takes. This probably took longer than it usually does because I'm talking to you. And usually once I release it, it doesn't click like that, but sometimes it does and we just fix it. So I just put a little dressing on now. I have the patient keep this on until Thursday. Today's Monday. So I just wear this for like a couple days. And then I want them to start moving it immediately, meaning even with the dressing on. I usually see patients back by 2 weeks and just check that everything's coming along, and that's usually it. They get one follow-up, no therapy, and that's it. This beats going to the operating room. You don't have to pay a surgical deductible. You don't have to be NPO. You can eat. Put this tiny little dressing on. You can drive yourself home if you are so inclined to do so. On your motorcycle. Don't do it on your motorcycle. I'm glad. Do not drive a motorcycle. But anyway, there's no narcotic pain medication given during the procedure. The patient is wide awake. I frequently have people returning to their activities within a week, including golfing, using their hands. Some of my non-compliant surgeon colleagues have gone back to work the next day and taken off their dressing against my recommendations and started working again. Not encouraged, but generally three days rest. And that's it.
The doctor's done both of my wrists. I had carpal tunnel syndrome from years of doing electrical work with screwdrivers and typing on computers and stuff. He's done both of my wrists, the carpal tunnel, which I had numbing in the fingers, and that was perfect. And then I've had a couple of the releases that he did today, and they were great. The trigger finger, it was one in this pinky, and I think it was the thumb or something. And so I knew once I felt that coming on, I knew what it was, and I knew it was a simple procedure. And as he says, it's just real easy. There's no prep. Come in. I don't think I've been in the building now an hour. I've probably only been in the building about a half hour. And I'll go home, eat dinner, and very simple procedure. Does a great job.